So you're just here to pick up little Gordon this afternoon? Great, everything went really well with his anaesthetic. He's still a little bit groggy though.
Okay.
So I'll go through his post-anaesthetic information.
Yep.
So tonight, just feed him half of his normal dinner. Now he has had those extractions, just the canine. So I'll just show you. So as you can see here, his teeth are beautiful and white and shiny.
Yep.
So that tooth is missing and there's actually just some purple sutures. So they're absorbable, so they will dissolve over time. But for feeding, because you don't want any soft, wet food to get sort of stuck in that pocket, it can cause infection. So you just want to feed him some nice cubed chicken breast for the next week. So I'm sure he'll enjoy that. So he might be a little bit drowsy for the next 12 to 24 hours. That's normal, but if it does persist or he seems dull or listless, just give us a call and we can have him come in and we can check him out for you. So I've just got a little bit of information on this home care advice for you if you do forget any of that. So we would like to see him back in 3 days just to check that his teeth are, his extraction spot is healing nicely and everything's going well. So I can book that one in now if you like. Any day, Tuesday morning, does that work?
Yeah, that's fine.
Okay, great, we'll book it in for then, perfect. So that's all booked in. So I've also put on Gordon's file a recheck dental appointment in 6 months' time. So we do like to get our dental patients back in 6 months just to check how everything's going and see where we're at and whether he's going to need another dental anytime soon. So we'll do that. So I noticed you said that you were only sort of giving the dentistics every now and then. So there is a lot you can actually do for their teeth at home. Now, the best thing you can do is brushing their teeth. Just like ours, brushing daily is the gold standard. But if you can at least do it, every second day or twice a week, it is better than nothing to reduce that plaque and that calculus build up in the mouth. So I've got here, we like to actually use just a toddler's toothbrush. It's a nice size for the smaller dogs, or you can use an adult toothbrush in a bigger dog. They do sell like little thimble brushes. We don't recommend those because putting your finger right in the dog's mouth can cause injury to you if they do decide to bite down or get a little bit annoyed. So the best thing to do would be to introduce this slowly. So with Gordon, you could just start by sort of slowly touching his mouth, touching his gums, getting him introduced to that, giving him some treats, lots of positive reinforcement. And then you can slowly introduce the toothbrush. So just like our teeth, you just want to lift up the gum and slide that toothbrush up the side. And then after doing that for a bit, you can introduce the toothpaste. So never ever use human toothpaste. It contains an ingredient which can be toxic to animals. And it also can, because they're not going to spit it out like we do, they can get a tummy upset from it. So this is DentiPet. This is a chicken flavoured toothpaste that we stock. So quite often the animals will actually quite like the smell of it. So you just put it on the toothbrush like so and brush it around. And eventually once you get really good at it, you can start doing the inside surface of the tooth as well as the outside, and that's really great for keeping that plaque and calculus at bay. Another thing to consider would be Hexarinse. So this contains chlorhexidine. So that's an antimicrobial product, and so that works to keep that infection and bacteria at bay in the mouth and stops that plaque and calculus from building up. So this one is aimed to be squirted into the mouth. So it actually is aimed to be squirted in once a day. You can also just put it on a cloth, spray it onto a cloth and start by wiping that in the gums just to get them used to it and then build up to doing it once a day with the actual spurt. So that's a really good product for keeping them healthy, because all of that bacteria that builds up in the teeth can actually lead to liver and kidney issues and make them quite sick in the long run. And then that can actually lead to heart problems as well. So it is, dental health is a big thing to think about. So I've got a little handout on the Hexarinse for you to take home as well. So another thing would be your TD. So I've got here, oh, you like that. So it's Hill's prescription diet. So you can only get it from vets, and they're actually a very fibrous biscuit. So if you have a feel of the size of those biscuits, they're quite big. So they actually work by, when the dog chews, they'll chew that biscuit and it'll sort of act to remove that plaque and calculus building up on the teeth. So that's a really good diet. You can use this as their full, completely balanced diet if you like. So that's something to think about as well. So I'll give you that sample, see how Gordon goes with that, and you could think about changing over and just introducing him slowly to that biscuit. The other thing, you were talking about dentistics. Now they are a good chew to get them chewing, but we actually stock Orovet, another good dental chew. So it's a funny green colour, so don't be alarmed if it does make their poo green. That can happen. So it's actually got an ingredient in it, and it stops the plaque matrix. So it acts to stop that calculus, the plaque, which then adds up to create the calculus. So it stops that from happening. So that's really good. And it's quite a hard chew. They've designed it so that it will stop them rushing their chews, and it will actually cause them to chew slowly and get through it, and just gets them chewing. So that's a good one as well. I'll give you that and just a pamphlet on Orovet to take home as well. And see how you go with those. Did you have any other questions about dental or about Gordon's dental procedure today?
No, everything went fine. It was.
The other thing I forgot to mention was that because he had that extraction, he did have pain relief. So he's had a meloxicam. That's an anti-inflammatory and pain relief injection. So he got that subcutaneously during his procedure. So that one will be effective at the moment and will last 24 hours. If you notice that he's in any further pain, give us a call, or if he's having trouble eating or he just doesn't seem himself, give us a call and we can sort something out and get him maybe some more pain relief.
No worries. All right.
Okay, and we will see you in 3 days for that recheck.
All right.
Thank
Thanks very
you.
much.